Hey everyone, welcome to the second episode of Small Talk by Aligner Co., your official part of affordable, easy to use clear aligners that help you get the smile you want without ever leaving home. Now we're here with Dr. Derek Weigand. He's an orthodontic specialist with over 10 years of experience helping people boost their confidence with better smiles. He is a trailblazer in modern dentistry, combining hands-on clinical expertise with cutting-edge teledentistry. With licenses to practice in more than 25 states, Derek has been a leader in expanding access to dental care through vital platforms, all while staying active in restorative dentistry, implants, sedation, and orthodontics. He's the managing clinical director at Fargo Moorhead Dental and Dentures, and consults for top teledental companies like Bite, Dentulu, and Dalcare. Now, today we're diving deep into all things regarding misaligned teeth. We are going to talk about crowding, gaps, overbites, underbites, twisted teeth, all the common problems that we've all faced at some point, or we've at least wondered about. Because, of course, with the social media in bloom these days, we all want these perfect smiles. So we're just going to go ahead and thank Dr.
Hey, Christine. Sorry, I lost your audio at the end there. Nothing coming through. I still can't hear anything currently. Sorry, try that again, Christine. Yeah, sorry, I'm not getting anything.
You hear me now?
Yes, yeah, got you now.
Okay, all right.
Sorry, maybe it was your mic. Last time
Yes,
we had tech issues that were my fault, and so I'm thankful that this time that it wasn't me. But but thanks so much for having me. I'm really happy to be here. I had a lot of fun last time, by the way, and I'm happy to be doing it again. So thanks again for having me. Yeah, so for what it's worth, I wanted to clarify. I'm a general dentist who treats a lot of orthodontic cases. I'm not a specialist in orthodontics, but so I wanted to clarify that. But yeah, and since your update, you know, I've a little bit about me. Like I've always practiced I graduated in 2013, and so I've been doing a little over 12 years now, and I started treating orthodontic cases when I was in dental school. I was fortunate enough to have like a really great instructor who held my hand and walked me down that path, and so I'm really grateful for that. But I've always worked in sorry, I forgot where I was going for a second there, but I've always worked in like rural America, and so I've always had like I've seen firsthand, like been so acutely aware of access to care issues, especially geographically. Like even now, I practiced in Fargo, North Dakota, of all places, and so there's like so many people who travel from really hundreds of miles away that come to see us, and so I've always been like trying to. I've always been passionate about teledentistry and passionate about like this kind of model where you can treat people from home, where it's still doctor led and doctor directed. And so I'm actually. You mentioned that I was licensed in like 25 states, and I think I'm up to 36 now. So I'm.
Oh my God! Okay.
Yeah, piling them on. So yeah.
All right. Thank you for the update.
Yes. Yeah.
But it's pretty amazing that you actually prefer to work in rural America, because I'm sure not a lot of dentists would prefer that.
Yeah, I mean, I was, for me, it was just like that's where I grew up, and so it was always I guess like small town USA has kind of always been where I grew up, and I went to dental school in just outside of Phoenix, Arizona. So that was my only experience in like big city living, I guess. But it was great to go to school there. It was a great place to live for 4 years, and then it was great to come home after that too. So,
all right. That's awesome. All right, yeah, so we'll get started right into our questions. We've collected some of the most common questions we hear from listeners, and I have a feeling we're going to clear up some myths along the way. So the first question that we got is, how do I know if I'm a good candidate for clear aligners instead of braces?
Yeah, that's a great question. So most like, I mentioned in the last Smile Talk seminar that, there are limitations to what clear aligners can treat, but I've been, the more I do it, the more amazed I've become at what you can treat with clear aligners. It's really, really surprised me, honestly. But the short answer is that most like mild to moderate cases can be treated with clear aligners. And then some of the more severe cases where there's issues with bite, with how your teeth come together, where there's or like sometimes skeletal, like just growth patterns, the way that your face and jaw develops. Sometimes those cases are more candidates for being seen in person by a dentist or a specialist to treat those cases. So. But again, I've been like, crowding, spacing, rotated teeth, cross bites, all of that stuff is can be treated with clear aligners in most cases, and now thankfully can be treated a lot of times at home. And so I guess the question might be then, how do I know if I have one of these things, or if I'm a mild or moderate case? And I think Aligner Co does like a free smile assessment. So that would probably be, I get photos sent to me all the time, and I get to evaluate whether someone's a candidate or not. So that's my job, and I love doing that. So yeah, that's the answer, I think.
Perfect. That's a very detailed answer. So I'm sure it clears things up for a lot of people. Thank you. All right. So the next question is, what happens after I finish treatment? Will my teeth stay straight forever?
If you wear your retainer, yes.
That was my question at one point.
Yeah, that's right. Yeah, everyone has that question. Yeah, it's so rewarding to get them off, or to get, if you're wearing metal brackets, everyone looks forward to the day where they can take those suckers off of there. And then for clear aligners too, people are just happy and thankful to be done, and not have to keep track of them. But yeah, so after clear aligner treatment, usually there's a clear retainer that's made that for the first few months, we try to get people or encourage people to wear it as much as possible, almost as much as you're wearing the clear aligners. Like most of the day is many hours, 20 to 22 hours a day. And then at a minimum though, like wearing it at night would be really important. And then onward wearing it at night as long as possible. Like I always tell my patients how like teeth have such an incredible memory for wanting to move back to where they once were, and it so things can change, and sometimes they change pretty quickly. You know, you forget to wear it for a couple of days, and then you put it in, and you're like, man, this is so tight. It's like because your teeth moved, you know, and it'll, you know, the retainer, oftentimes little things it'll move back, but if things get too kind of drift back to if you relapse too much, that can be a problem. So permanent retainers also are really helpful, like permanent retainers on the bonded on the backside of your front teeth. Those can last sometimes forever. So
yeah, it would be good for people like me who keep forgetting things.
Yeah, no doubt. Me too.
If I were to ever wear a retainer, I'm pretty sure I'll forget it, and I'll be back to you. I'll be coming back to you for a retreatment.
Yeah, that's what I'm here for. But yeah, it is hard.
No, but this is such a good breakdown, you know, telling people exactly what they're supposed to do, how long they're supposed to wear it full time, and then they can move on to nightly use.
Yeah, thank you.
But again, you never get rid of them.
Yeah. Wear them all the time. Yeah.
All right. So moving on to our next question. Can clear aligners help with jaw pain or TMJ problems caused by misaligned teeth?
Yeah, yes, they can. For misalignment, they certainly can, and that is like one of the major causes of jaw pain is bite discrepancy or misaligned teeth, like a premature contact. And what I mean by that is that like all of your teeth should touch at the same time, really, when you bite together. And I don't think people realize how incredible your bite force is. And when you you have muscles here and here that are muscles of mastication, and if you're contacting on one tooth or one side of your mouth prematurely, that can create a lot of stress and strain and disharmony between the two joints, and that can lead to TMJ, jaw pain, even like some debilitating stuff, migraine headaches and that kind of thing. That I see every day, and it's kind of it's really, really tough to see these people suffer. But for those cases, definitely alignment of any kind, whether it's clear aligners or conventional braces, can help tremendously with that. And then there's other causes of TMJ too that may not be resolved by straightening your teeth. Sometimes it's trauma, facial trauma, if you had that earlier in life, or stress induced. Sometimes, we all just kind of live stressful lives. And so sometimes if you're clenching or grinding your teeth, even if you don't know it, sometimes during your sleep, you can do those sorts of things. And it just creates a ton of stress and pressure, create TMJ symptoms that might not be alleviated by clear aligners. So hopefully that helps answer that question.
It does. Thank you for that.
Of course.
All right. So then the next question is, are results with at-home aligners as effective as in-office treatment? Yeah,
most often the answer is yes. For those mild and moderate cases that can be treated, again, we try not to approve or move forward with any cases that aren't for patients that aren't a good candidate. But definitely, like if your smile assessment comes back and says like, hey, yeah, you're a candidate, you can expect to get the same or very similar results to what you would get in office. It's the same kind of treatment, like doctor led and doctor directed. And so you're kind of getting the best of both worlds, the convenience of treating it at home, but still being under the supervision of someone who's watching it and making sure that that nothing goes wrong along the way. And so yeah, it's in almost every case, it's as long as you're compliant and consistent with wearing your retainers and aligners, most importantly, to get the results. But if you if you aren't able to wear them 20 to 22 hours a day, or if you're on the night aligner plan, then you're wanting to wear them for 8+ hours during your sleep, then you have to stick to that to get the results you're looking for. I'm sure it's kind of self-explanatory that you have to wear the aligners to get the result. But yeah, in most cases, it's as effective as having it done in a dental office.
So the key point here is that unless you stick to your schedule, they might not work. I mean,
right? Yes, yeah.
Job for them to do theirs.
Yeah. Them coming to your mailbox has nothing to do with the result. Like you gotta put them in your mouth. So yeah, it's really important.
All right. Thank you so much for that insight.
Sure.
All right. So can clear aligners fix all types of misalignments?
Yeah, maybe not all. I think we kind of answered this question already, but it is a good question. And in most cases, yes. And again, I've been so amazed with the results that I've seen, like watching these cases progress over time. And sometimes, I mean, it's just so surprising. I've sometimes kind of pushed the envelope a little bit and kind of thought like, well, we're going to do the best we can. And patients really want that kind of treatment. They don't, especially adults don't want to wear brackets and wires, and so they really push sometimes for clear aligners. And sometimes I let myself get kind of pushed into those situations where I'm like, hey, I don't know, if we're going to get everything that we're looking for, but let's get as close as we can. And I've just been amazed at how effective they are. So in most cases, most cases of just basic misalignment, like, hey, give me straight teeth, give me a nice smile. Absolutely. They work really well for that. So.
Perfect. All right. We have two more questions. Can misaligned teeth cause gum recession or tooth sensitivity?
Yeah. It sure can. Sometimes, and again, I think we've talked about this a little bit in the last one, but yeah, misalignment sometimes creates discrepancies where the way the tooth emerges from the gum, if it comes through in a natural way and in a straight position, a lot of times that tissue is really healthy around the tooth, whereas if it's the tooth is rotated or if it's too crowded, sometimes there's not enough room for gum tissue to even fit between the teeth because they're so tight together. And then alternatively, sometimes there's so much space between teeth that the gum tissue just looks flat. There's no emergence of that gum tissue between the teeth, and then it creates issues with not being able to clean properly because that space is so tight and you can't floss, and the toothbrush bristles aren't able to get in there, and it can create a lot of problems hygienically too. So and then as a result, if you end up with recession, or if the gum tissue is not naturally attached to the tooth the way that it should be, then you get root surface exposure, and that creates a lot of sensitivity. And so absolutely, the answer is yes to those questions.
All right, that actually, I didn't know that recession sensitivity could happen because of crowded or misaligned teeth, but I'm glad that I asked this question.
Yeah, glad I could help.
All right, so the next question that we have is, do I really need to fix my misaligned teeth if I'm not in pain?
No, I mean, if you're okay with it, that's totally okay, and there are a lot of people who have who have misaligned teeth, and that's perfectly okay. And sometimes culturally or just preferentially, I've treated a lot of cases where someone really wants braces or clear aligners, and they have a gap between their two front teeth, and I used to always assume that you must want that space closed, and sometimes they don't want that, that's their thing, that's their trademark, and they don't, and so sometimes we leave that open. They want the rest of the teeth straight, but hey, you leave that gap, and so we do, and it works out really well. But but yeah, I mean, if you're happy and you're not in pain and you have healthy teeth and healthy gums, and then, you know, keep on keeping on. That's totally okay. But yeah, for people who, you know, whether it's just cosmetically, it's not necessarily vanity, you know, but people want straight teeth. So even if you're not having issues and you're just like, hey, I just want a nicer smile, this rotated tooth has always bothered me, or this space, or this overlap, or whatever it is, then, you know, whether you're having pain or not, you can absolutely do clear aligners to fix that.
I've actually heard some customers think that the gap in your tooth, that's considered good luck.
Yeah, absolutely. Yes, that's exactly right. Yes.
So yeah, I'm sure nobody would want to close that gap.
That's right. Yeah, we're not going there. Yeah, we'll give you what you want.
All right, so that's a wrap in our questions. I believe that was the last one. I'll quickly check though.
Yeah, sure.
All right. Yeah, that was the last one. So that was pretty insightful. Thank you so much for breaking down everything so clearly, Dr. Weigand. I appreciate it, and I'm sure that our listeners would appreciate it as well. Now we'll give the floor to our listeners, and if they have any questions regarding whatever we've discussed here, or if they have anything that they'd like to ask, we'll leave the floor open for them.
Good.
See what comes in.
Yeah, absolutely.
Okay. So in the meantime, was I correct about the 10 years experience that you have? Or have you been working longer than that now?
Yeah, maybe that was, that's probably information from a couple years ago. And my photo, I need to update my photo. My photo might be, I look so young, and seeing that photo, I've life comes at you fast sometimes, but
that actually happens. You look back to 2 months ago and you're like, wow, what happened to me?
Yeah, I look so good. I look kind of rough now. Yeah.
It gets to you.
Yeah. But yes, so I graduated in 2013. So yeah, I graduated in May of 2013. So a little over 12 years now that I've been practicing.
Perfect. All right, I'm still waiting for the questions.
Yeah, no problem.
Facing a little bit here.
Oh yeah, they're just trying to filter them all in.
Let me just quickly. All right, so here's one. Can my 6-year-old get aligners treatment?
6 might be a little young because they're probably just starting to get their permanent teeth. We typically like to wait until there's a full set of adult teeth, which usually happens like closer to 12 or so. I mean, there are cases where I see plenty of kids that like have a full set of adult teeth at like 9 years old. And in that case, then absolutely, you know, you could start clear aligner treatment then. Sometimes a 6-year-old, you can see as they start to get their first permanent teeth, you can tell right away, like, man, there's just not enough space here. We need to do something to create space. And typically clear aligners probably aren't the solution for that. Like, you probably need more conventional treatment for that sort of thing. But I don't think I've never treated I think 8 or 9 is probably the youngest I've ever treated a child with clear aligners. So.
All right. So can aligners cause lisp or soreness?
Initially, yes, maybe for the first few days. it's such a thin, like low profile material that typically people adapt really well. They still put, I mean, it's very gradual forces, very light forces, and very gradual movements that we're creating. But sometimes that can, just the pressure, having pressure on your teeth, you know, for the first few days, it's kind of like when people go in and get their braces put on, or when they come back for their monthly or their 8-week visits for changing the wire to, you know, some people say it's kind of like tightening their braces. It makes them sore for a few days afterwards. And, you know, sometimes everyone's tolerance is different. Like a lot of my patients are like, no, it's fine, no problem at all. And then others are like, yeah, it was pretty sore. I had to take some Advil or whatever. And that's okay. Either way, you know, it's, we do expect a little bit of soreness for the first few days, but after that, that goes away. And likewise, you know, certain sounds where the tray kind of rests against the backside of your teeth, certain sounds might sound a little different. It might create a small lisp, but people adapt pretty quickly. Usually within a day or two, they're back. You know, even if they have to give a speech or something like that, they do just fine.
I think that's reasonable. That's fine.
Yeah.
All right. So we've got another question. I grind my teeth, so not sure if I can get aligners. What do you suggest?
Yeah. It would actually help quite a lot with that if, you know, we make night guards for people or some people who, you know that they have anxiety, or they just become, you know, hyper focused and clench their teeth or grind their teeth. We make them guards that help protect their teeth. Clear aligners kind of serve a dual purpose in that regard. So they help with both. They would help straighten your teeth, but also help protect your teeth if you're grinding or clenching. So yeah, you could absolutely still do clear aligners if you clench or grind your teeth.
Perfect. Okay, this one I would actually like to know as well. Am I a suitable candidate for aligners if I have a cramp?
Yeah, absolutely. Yeah, and sometimes that even works better because sometimes it's so hard to get a bracket to bond to porcelain. But with clear aligners, since you're not relying on bonding, and it kind of just, you know, surrounds the whole tooth. Yeah, it works very well for people with crowns.
Okay, I did not know that. You cannot, I mean, it's harder to bond brackets to porcelain.
Yes.
I thought it works on everything.
Yeah, I mean, and sometimes it does. We have newer materials now, but years ago, even a few years ago, like, oh my gosh, it was so frustrating. Like, you put a bracket on a crown and they'd come back the next day and the bracket would be off. And yeah, it's I'm thankful things are getting better, but it's still a frustrating experience sometimes. But yeah, you can absolutely move crowns with your aligners.
Good to know. If I ever need aligners, I know that I can get them.
Right, yeah. Implants, however, implants don't move with clear aligners. So you can move the other teeth around the implant, but implants are fused to the bone, so they don't move the way that natural teeth do. So
of course. All right. Okay, we've got a couple more. Can I proceed with aligners having a minor recession?
Yes, yeah. So if the recession is minor and under control, then, you know, as long as it's not actively getting worse, if it's not, you know, there's lots of reasons for recession, of course, and sometimes people they maybe brush too hard. Sometimes it's like a genetic thing, you know, as all of us as we age, we naturally have a little bit of recession, and that's totally fine. It's just, you know, if you have like active gum disease or something like that that's causing the recession, we would want to get that under control first before we do any kind of orthodontics. So
perfect. All right, can I opt for aligners after extractions, or braces are better?
Yeah, you can still do aligners after an extraction. Yeah, absolutely.
Oh, okay.
Yeah, no problem at all. Yeah.
And braces as well.
Right. Yes. Yep.
All right. Let me just quickly check if we've got any more questions.
Sure thing.
I don't know about anyone else, but I feel like I know what I need to do with my teeth now.
Well, I'm so glad I could help.
Thank you so much.
Yeah, it was awesome.
I did not expect this would be so insightful for myself as well, because I thought, I have teeth that look fine, but now I know there are problems.
No, you have teeth. You have a beautiful smile.
Thank you.
You have great teeth, and so many other people. We're all so critical of ourselves. It's just natural, and again, it's not vanity. It's some people just want something better for themselves. Sometimes it's like the first step of self-improvement. They get it's so rewarding to see that, whether it's watching someone's progress, through uploaded photos online or seeing them in my practice. That sometimes it's people get a smile makeover or they finish orthodontics and they're so proud of their smile, and that's their start of like, you know what, I am so proud. I'm gonna they start working out and they start eating better and they want to whiten their teeth and they want to and it leads to so many other great things. Sometimes it's awesome and it's rewarding to see. So
I actually read about this woman who started walking, and that led her to, because she started walking and she saw herself doing it for a few months, that she moved ahead and she started a business. I mean, that's so.
Isn't that amazing? Yeah.
I mean, you think about it. I mean, what could a walk do? You just go out and walk for 10 minutes, but you walk a year for 10 minutes every day. That's consistency, and that helps you. So, yeah.
That's right. It's small steps, and sometimes those little things, little positive changes make such a huge difference. I mean, aligners are a perfect analogy. Just these little changes that we make in your teeth have huge results over time. There's so many things that you could. So many things that are analogous to life in that. It's awesome. It's cool to see. So.
I can see a lot of people that are listening to you and they like what you're talking about. So we have a lot of other questions as well. Can I eat while wearing aligners?
It's best if you take them out while you eat, and then brush your teeth and put them back in. So that's why we say total wear time throughout the day is like, we try to get you wearing like 20 to 22 hours a day, and that. Those couple of hours that it's okay to have them out is typically while you're eating and brushing your teeth. So yeah, it would be recommended to take them out.
All right. Can aligners treat open bite?
Sometimes, yes. Again, like those mild to moderate cases, probably so. Sometimes, a lot of times, open bite is you have to extrude the teeth, which means, if your upper teeth are too high and they're not coming together in the front, like when you can't bite through something the way you want to, you have to pull the teeth down to do that. And that's kind of a harder movement for clear aligners, but it's not impossible if it's minor. Sometimes younger patients have maybe they kept a pacifier in that child's mouth too long, or the child had a habit like sucking on their thumb or something like that. Those cases can be a little harder to treat if it's like a pretty big open bite. But again, with the mild to moderate ones, that can be done. So.
All right. So we'll take just one more question before we wrap up.
Sure.
Do I need to see a dentist or an orthodontist for aligners?
No, that's what this is for. So you would be seeing a dentist or an orthodontist who would be reviewing the case, but reviewing your photographs and checking to make sure that you're just that you have a healthy mouth. That sometimes we see cases where you can see someone has gum disease or has active decay, and those are cases where it's like, hey, let's put this on hold for a while. Not saying you're not a candidate, but right now. Go take care of these other issues before we treat the misalignment, and that's why it's a perfect blend of like being doctor led and doctor directed, but also being super convenient to have. Again, if you're like some of my patients who come see me, if you live 100 miles from the nearest dentist, that's really tough to make those appointments every few weeks.
Yeah.
And so those, that's a perfect scenario. But yeah, anyone would be a candidate, and it would still be directed by a dentist. So.
Perfect. All right. Thank you so much, Dr. Weigand. This has been absolutely insightful. And for our listeners, that's a wrap on this episode of Smile Talk. If you've learned something new today, hit the follow button, share this episode with a friend, and don't forget, you can always send us your smile questions for future episodes. Thank you so much for listening. And as always, keep smiling. We'll see you next time.
Thanks, everybody. Thank you, Christine. I had a ton of fun. I can't wait to do it again.
I had a lot of fun too, and I learned something.
That's right. Yes. Yeah. Hopefully people can see my passion for this sort of thing. But I just love stuff like this. So thanks everyone. And